All right. So cardiovascular system.
I thought it was circulatory.
Same deal. Mary just had this little mini heart attack. Circulatory. So in your book, it calls it circulatory because it includes the lymphatic system. So I'm not doing the lymphatic system in this unit. We're putting that into the immune system because that's where it belongs, and your book isn't the best. Okay. So cardiovascular system. Why does it always do that? Okay. Cardiovascular. Okay. So the name gives it away, and what's included in our cardiovascular system? Yes. Anatomy includes, yes, the vasculars. No. Heart. Good. Blood vessels. And I heard Mary back there. Mary already is an expert on all of this because she will give you a much more riveting presentation next week on all of this, I'm sure. So anatomy, so heart, blood vessels, and blood. So those are the three things we'll look at for this unit. All right, let's move along. So we'll start with the blood a bit, I guess, okay? So does anyone kind of already know what the blood is made up of? What? So you know what it does, yes. Okay, so let's just talk about what's in it first.
Blood cells, red blood cells, and cells without fluid.
Plasma. Plasma. So does anybody know what plasma is good for? If your textbook is in front of you, you can cheat. So it's mostly made up of water, so let's say that first. It is fluid, you're right. What's that? It contains the blood cells, so it gives a structure for your blood cells to be carried in. So contains other cells. Whoops, contains other eels apparently. No, it doesn't. Just ignore that. Contains is my spelling there, okay? So contains other cells, so your other blood cells. And it's important for transporting certain things. So when your body gives off hormones, it's in your plasma. When you take a drug, it's transporting in your plasma. Vitamins and minerals, which you guys did in the other class. So we'll say transports. So other than cells, other important things. So transports important things like important things like vitamins, drugs, hormones, yes, hormones, nutrients. So when you eat and your body digests it, and we haven't done the digestive system yet, but when your body absorbs those things, it's circulating throughout your body in your plasma so that it can bathe all of your cells in it, because all cells need food to live, right? Okay, so that's the first part of your blood. So you guys are four parts that make up blood, okay? So
We only have one.
those are the structures. That's what makes up the cardiovascular system: heart, blood vessels, and blood. So when we're specifically talking about blood, there are four things that make up our blood. So you what? The system?
Red blood cells.
Yes. Red blood cells. Oh my goodness. Red blood cells. It always makes me do that.
Is that like if you're red blood cells are down, is that why they give kids
That's for electrolytes. So Pedialyte is for electrolytes. But if you have like low hemoglobin or hemoglobin's attached to your red blood cells, so we'll talk about that. What, sorry? Not necessarily. Not necessarily. So I'll go over that. Okay. All right. Red blood cells. So Mary gave the other name for it. So if you see erythrocytes, that's the other name for red blood cells. So these cells are what makes your blood look red. So the whole reason plasma looks kind of clearish, other cells are kind of lacking color a bit. Red, it's that's kind of a myth. Yeah, kind of a myth, but yeah, red blood cells are red in real life. Plasma is kind of clear. Plasma is just the fluid part. Yeah. Yes. So some people just can get like a plasma transfusion and that's all they're giving. So if you go and donate blood, they can spin it to. Is there a question? I can't hear myself talk. So someone asked about getting like plasma transfusions. So sometimes that's all somebody needs, and you can see why plasma would be important in that it's transporting everything. So even your other cells, your other blood cells aren't going to be working properly if there's not enough plasma taking it. Yes. And sometimes if you're low in red blood cells, then that's when you would see like a typical blood transfusion with the red bag of blood hanging up too. Okay. Red blood cells, what do you need to know about them? So let's just say they give blood your red color. So this is where, contain hemoglobin. Does anybody have low hemoglobin? Who does?
Yes, I do.
You do?
I've been anemic since I was.
Have you?
Yeah.
So, yeah. So, hemoglobin is what carries our oxygen. Yes. So. Well, sometimes that can happen if you're dehydrated. It can give a improper reading. But if you're really hydrated, it can also give a wrong reading too, but how hydrated you are can affect it. So if you didn't drink any water or anything that day before you went to your appointment, then it could have made the results off. Yeah. Yes, Caitlin. What, sorry? That's if they're picking it up, so to take it out. Yeah. Yeah. Okay, so red blood cells, that's how your oxygen is being transported around your body. So if you're low in red blood cells, then your body's not getting enough oxygen. So what kind of symptoms? So we've already talked about this kind of in different places. If your body's not getting enough oxygen, what's going to happen? You're going to feel very tired. You may be short of breath. Yeah, like really tired. It would be. Yeah, 'cause it puts your body under stress, so it could affect your immune system. Yep. So if you have low hemoglobin or you're anemic, one of the big signs is that you're tired all the time.
It could be chilled, chilly, cold.
Yes.
You're not getting warm.
Yep.
So that's how when the doc orders the CBC count like that.
Yes. That's a complete blood count, and it's included in there. Yeah. Yes. So all of these things we're kind of talking about here, you would probably see in that. A blood bank. So okay, so if you are donating, so a blood bank is really just where they're storing donated blood. So are you like Rh negative? Yeah. So Winrow, the shot you get, is a blood product. So that's why they're always taking your blood type when you're pregnant. Yeah, that's why it's a blood product. Yeah, so there's special procedures if they're dealing with blood products. Yeah. So the third thing in blood, so the first two, plasma and red blood cells. So I heard you guys already say white blood cells. Okay, so do we know what those are for?
Fighters.
They are the fighters. So we'll get more into this in the immune system. So we will do an entire course, our entire class probably on these guys. So we'll leave a lot of that information for later, but we'll just say protect body from infection. Protect protect body. I'm not documenting. This is only for YouTube, not a legal document. Okay. So white blood cells protecting our body from infection. Okay, so we'll kind of leave it. And the other word for it is leukocytes. So if you see that in your textbook, the other. Yes. Yeah, that's how those medical terms work. Yep. So there's one more thing. So we have white blood cells, red blood cells, plasma. Can you think of one more? Platelets. Wait a minute, did I spell it right? Yeah. No. Just wait, did I spell it right, guys? Platelets, yeah. Yeah. So thrombocytes is the other word for this one. Does anybody know what platelets are good for? Clotting. Helps to clot blood. Okay. So I have a couple of pictures. So far, so good. Good. So this is a cool picture. What? So this is a cool, like, microscopic picture of a red blood cell in a blood vessel. So it's kind of cool. So look how tiny that blood vessel is compared to the cell. So we'll talk more about blood vessels, and there are different sizes of them as you go through the body. So that would be one of the tiniest. So that one blood cell barely fits through that blood vessel. The blood cell? Yeah, they fit through though. So there's kind of like a representation of size and what they kind of look like. So your red blood cells are kind of a little bit flat looking, kind of disc shaped. If you want. Yes, they do kind of look like cough drops. Yeah, so they're a little bit flatter and disc-like.
Doesn't leukemia?
Yes.
That's where the white blood cells are from that eating the red?
Yeah, one type, yeah. Yeah.
She got diagnosed on Saturday with it, and she died Sunday.
Wow, so they didn't know, eh?
And they look like teeth.
So the platelets are just kind of tiny. They almost look like cell fragments almost. And then white blood cells have, like, they don't really have a color, more kind of whitish. And you'll notice they usually, whenever you see pictures of them, they have kind of spikes happening on them. So again, we'll talk more about white blood cells later. And this just shows, so this would be a blood vessel. So this would be a tiny one because like one red blood cell barely fits through there. And how they're floating in the plasma. There's a white blood cell, some little platelets. So the plasma is the fluid that these cells are suspended in. Yes, all of them are kind of floating in the plasma. Yep. So plasma really doesn't have color. So when you see red blood, it's really you're seeing the parts in the plasma. But the fluid itself is mostly clearish to yellowish.
Yeah, if someone takes allergic reaction, say with Dilaudid, they flush their system with plasma.
Yeah, because it can dilute the drug down. So that's one way they can help, yeah.
So why do people use charcoal? I think that's maybe for a lot.
So charcoal can bind to a lot of things. So partly throwing up can sometimes be good for some things, but charcoal binds to a lot of stuff. And so it can make your body absorb less of the drug.
Oh.
Yeah.
Yeah, when I was in the hospital having one of my kids, somebody's kid was like pharmacol or something.
And they gave charcoal. Yeah. So it can, yeah. So that is a side effect for most people, which can be good if you're trying to get it out, but it also prevents some of it from being absorbed. That's a little different. So that's when they're putting a tube down to actually suck it out.
I guess that's not
No. So this just kind of represents what your body or your blood is made up of. So if you were to take someone's blood sample and spin, it's called a centrifuge. So it like spins it. It will actually separate into something that looks like this. So it will show how, just over half of your blood is made up of plasma. It's really a small percentage of white blood cells and platelets. And then a little under half is your red blood cells. Kind of shows the makeup.
Like they do on CSI in the machine, and they spin it.
Yeah. Yep.
Is that what they shake it up with?
Yes. So when they take your blood, so if they're drawing blood into the tube, so some tubes have different chemicals and things inside of them. So some of them have chemicals that prevent it from clotting. So by doing this, they're kind of mixing it with that clotting medication. Yes, the tube already has stuff in it. Some tubes don't have anything, so the blood can freely clot as it wants in those tubes. But some of them have stuff in the bottom of them that can prevent clotting, or there are different tubes that do different things. You notice like there's different color caps on all of them that they take. Yeah. So some of them are specific for drawing blood for sending to the blood bank to have it tested. So those would have like a purple cap generally. So CBC, when you mention like complete blood count, is usually a red top tube, and those tubes actually don't have any additives in them. Other one like
Yeah, there's a green cap.
green, I don't remember what goes into green. Blue, if you're on warfarin and you need to be tested for how thin your blood is, that's a blue one. Green, I don't remember. I think green you can sometimes use instead of red. I think a lot of them are the same maybe. I don't remember exactly what's on the list for green.
I know.
Yeah.
Magnet, they do like 6 or 8 or 7 vials, right?
Yeah, a lot.
So that covers pretty much it.
Pretty much, yeah. Yeah. And like some tests they can put like many into one tube, but some tests they need their own tube as well. So it all depends on what the doctor orders.
So I think it's separate from it, like because they usually take 6 from me.
Some tests need their own vial, and that test must need more of the blood product. Yeah. Yeah, usually you're getting tested for multiple things too. Yeah. 11 tubes. Yeah. Yeah. So if you donated blood, so like Nancy said, some people might just go and get plasma. So if you go and donate blood, they will put it through this centrifuge to spin it out. They'll collect the plasma off the top, and so you can donate just that. Yep. And it ends up looking kind of like that, and they can just give people plasma or just give them. Yeah.
So you said less than 1%?
Yeah, a tiny amount is white blood cells and platelets.
55, 45 is 100, so.
Right. Yeah. Yeah, it's really tiny. There's that math again. Yeah. So as anyone knows, if you have like a major infection going on, what do you think might happen here?
White blood cells will multiply, right?
Yeah. So your body makes more white blood cells, so we'll do that in the immune system more, but this might change a little tiny bit if you had some major infection going on. Because it's your body's way of fighting it off. Okay. An infection?
Well, not as sick as I was that first time. That first time I thought.
Oh, yeah. Hopefully. Okay.
I think we just got some bacteria.
Okay, so your heart's kind of your main guy there. So it's going to pump the blood throughout the rest of your body. It's kind of in the middle, slightly to the left of your chest cavity behind your breastbone, and about the size of the fist-ish. So it has 3 layers. So really this will only come up in your line of work is if you hear someone has a condition related to these. So you might hear pericarditis. So what would pericarditis be? Yeah, so some kind of inflammation or infection of the outer layer of the heart. So an endocarditis, what would that be? So the inner lining of the heart, so is your endocarditis. Yeah, so endocarditis would be an inflammation or infection of the inner layer of the heart. So that's really the only time it will come up. So you're not going to be documenting personal care and say, you know, the client complained of their myocardium and their endocardium. So you're not going to document that stuff, but there are these 3 layers to the heart. So this middle one, myocardium, that's just the thick muscular part of your heart. So when you think of the heart, that's usually what you're thinking of, that middle piece. So this slide actually just kind of talks a bit about them, but in my mind it's not. So your book, this is where your book fails you, I find. Sometimes they're trying to set things out in an easy way to understand it, then they add stuff like this in. Do you guys think you need to know this to be CCAs? No. So basic anatomy, so it's useful to know these things. So I think this course is good. It's good for you guys to know the basics of this stuff. But like, why you don't need to know pericardium, myocardium, endocardium. But if you were to see that someone had endocarditis, you might think, oh, that's a heart thing, right?
I think you personally need to know more of that if you were going to work in a hospital.
And, you know, even if you're working in the hospital, so kind of knowing that these are related to the heart would be good, but actually knowing these 3 layers, yeah, I'm not so sure. So don't remember visceral pericardium. Please don't remember parietal pericardium. But you are seeing these.
Myo and endo.
Yeah, but you are seeing these things in your textbook and that kind of stuff. So that's why it's there. Okay, so we'll start into this guy. So this will give you nightmares for the next week probably. But once you get it, you just get it, and it will be okay once you understand it. But you do have to kind of practice and go through the steps, and Mary's going to help you do that too, because she has.
Myself, you're from school.
Yes. Okay, so what we're gonna do, so I was thinking, how can we make this easier? So I gave you a coloring sheet. So I will attempt to draw this heart, and as we talk about it, we can color it and label it, okay?
Good girl.
So I didn't know people would be so excited about, I just stole it from the internet.
I was just thinking,
No, I made the sheet, I just found the picture. Yes, do you want one?
Oh, yes.
but when she said this morning, you gotta know they're on, I'm like, she's not gonna make us do both. Oh, this is hard. I know, look at that.
Coloring contest, guys.
Coloring contest.
Coloring goes on. Oh, don't even get all excited now.
Don't even.
Don't
Yeah.
Don't eat it.
Don't even.
Don't color it yet. Wait and kind of label it.
Does anybody need blue and red? Let's see what we have here.
I think there's probably 15 different blues.
So orange would probably be okay too if you have to deal with orange. Do you need some colors, Brian?
Okay, I've got
You guys are good.
color pencils from yesterday.
You guys, your guys are good.
Yeah, we have pink.
You guys are good. You don't need.
I have not touched the top with you.
I have blue. You need one?
I don't have the rubber.
I don't have a red. Can we? Do you have an extra red? Actually, let me see if I can cheat a little bit here. Maybe I won't have to draw the heart. Let's see. Oh yeah, in nursing.
Although that class, I did study 2 nights. 2 nights, which normally I don't.
Oh yes, please do. How can I adjust this size? Doesn't want to. Oh, there we go. Look at me, I'm a cheater too.
No, I like it because you're in the same exact picture, so we can see exactly.
Because my drawing would not have been the same exact picture. Although last time I did do very well, but okay, let's start there. Okay. So, how about we first start with labeling before we talk about blood necessarily, okay? So, let's get some blood. All right, so atria or atrium, so that's what you're going to think of. So this is the heart is kind of a hollow structure to start. So inside there are these 4 chambers inside the heart, okay?
That's 4?
It is 4. So there's 2 smaller ones up here that are the atrium, and then 2 larger ones down here that are the ventricles, okay? So the atria are what we're going to think of as they're the guys that kind of receive the blood from the outside. So if this is a heart, which side is going to be right and left? This is the right. So let's add that. because this is important when you're labeling. So this is my heart. This is my heart. This would be my right. This would be my left, right? So on your paper, make sure you're doing it. So hold it up to yourself is your best way to think about it. Yeah. Right. So hold it up to yourself, and this is your right side. This is your left side. So that's the best way to think about it. Okay. Okay, so we'll start with kind of labeling the anatomy. So right ventricle or right atrium. So these atriums, and we'll talk about what they do more. So we'll start with these 4 chambers of the heart. So these smaller chambers in the top are atrium. Okay, so those top 2 chambers are atrium, right and left. So if you were labeling this, make sure you know your right and left. Okay.
All of us with the test will be like,
Yes. Okay. Okay, so then these bigger chambers connected here at the bottom are ventricles. So we have right ventricle, and left ventricle.
okay, I'm sorry, the atrium brought it in?
Yep, and we'll go over the exact blood flow, but yes, the atrium, if to think about it generally in your head, they're going to accept blood from other places. And your ventricles are the ones that are going to push it out of the heart to other places. But we'll talk about that more. Okay, so we have the 4 chambers of the heart labeled atrium and ventricles. Okay. What else do we need to know? Okay, so let's go to, so outside of the heart, you're going to have some blood vessels that are connected to it. So this is one of those blood vessels, and this is one of them. Okay, so these are new words that will stress you out. Superior Vena Cava. Yeah, so we've learned those terms superior and inferior. So superior means higher, inferior means lower, right? So down here is the inferior. Okay, inferior Vena Cava. So superior and inferior Vena Cava. And these are both veins, okay? So we'll talk more about blood vessels, but these guys are veins. We will talk about the difference, yeah. So we'll just worry about labeling the heart, okay? So up here is another major blood vessel. So this is the aorta, yes, and it's the largest artery in your body. So artery. Not usually. So if they've had a heart attack, you mean, getting a stent put in. So we'll talk about that again. But your blood is your heart is a muscle that requires a blood supply just like anything else. So you have blood vessels running in your hand. Well, on the outside of your heart, you also have blood vessels. And so those blood vessels that give your heart blood are where you would put stents.
Your aorta runs,
Up, generally off the top of your heart, yes. And then it starts to branch off into different arteries.
Is that the one that goes?
So what runs way down?
No.
Run through,
Yes.
or like down your spine.
as your aorta goes down, it will go down, and then it starts to branch off. Yeah. Okay, so aorta is an artery. Okay, so let's start a new, because as I'm talking about these here, okay. So let's do heart anatomy. So superior, and inferior vena cava. Superior and inferior vena cava. So these are veins, and they bring blood from the body into the heart. So we'll talk about this more. But this is just a general into the heart. Yes. So aorta is an artery, largest in body. And this one is going to take blood away from the heart out to the body. Okay. Sure I'm not forgetting anything. Okay, so let's go back up here for a second. So then we have these other blood vessels here. So these other ones that are sticking out randomly as we go around. Okay, so when we're coming from the right side of the heart, these ones are called, but it's coming from the right side, sorry.
Oh my God.
Yes, left pulmonary artery. It is, because then over here there's also a right pulmonary artery. Let me get rid of this just to avoid confusion. So as we talk about how this works, it might make more sense, so try not to stress yet. We're just labeling, okay? Oh, it always does that. Stop it. Okay. Right pulmonary. Pulmonary artery. That's supposed to be an O, sorry about that. So then we have some arteries coming off of the heart. So any guesses what pulmonary means? I know Mary knows because she's already done her whole unit. Pulmonary. Pulmonary. Have you ever heard of like pulmonary edema? Have you ever heard? So it has to do with lungs. Yes. So where do you think these things are going? To the lungs. So pulmonary arteries are going away from the heart to the lungs. Pulmonary arteries. They do not carry oxygen. Carry blood. Carry blood from the heart to the lungs. I'm sorry. Did you ask me for one and I ignored you?
No, I
Okay.
just walked in.
Sorry. Pulmonary arteries. So they are carrying blood away from the heart to the lungs. So pulmonary.
You're gonna be fine.
Okay. So then we have these other guys sticking out here. Let me just get rid of the left here. So if the blood has to get to the lungs, it has to come back, right? So that's why we have pulmonary veins.
Oh, they're both the same? Okay, one lead, two things.
Pulmonary vein, and we have right and left again. Okay, pulmonary vein, pulmonary vein. So what do you think these guys are here in the middle? What are these guys in between the chambers? Kind of. They're valves. So here's your atrium and your ventricle, your atrium and your ventricle. So right here we have valves. So sometimes, did anyone ever have a child that was born with some issue with their valves? Or a heart murmur sometimes. So that's usually what's happening here. So if you can hear weird sounds happening in the heart, there's usually something going on with these valves. So what do you think the purpose of them are? They do open and close. For what? Yes, it's to make sure blood is going in one direction. So if blood is traveling from here to here, it's supposed to prevent blood from going back up to where it just came from. So it's to convince the blood to keep going in one direction, like a valve on a sippy cup. So I don't know what that term is, but if a valve's not formed fully, then it's possible that blood can go back up to where it wasn't supposed to be. So essentially, you may not get the same amount of oxygen in your blood because blood's going in the wrong direction. Sometimes the valves can get really stiff though too, so then they're not opening and closing properly, but same result, you might not get enough blood flow, so your body's not going to get enough oxygen. Okay. So these guys here are valves. And they have their own fancy names, but let's just not talk about those for now. Okay. So there's another place there's valves, so in between the atrium and ventricles, but then this is a valve, and so is this. And so that valve is before it goes out to the pulmonary artery. So same deal though, it's going out so that it can't come back in. And this one is a valve to the aorta. So same reason, so that blood is going in one direction. There is, but we're not going to talk about it. Let's not speak of those for now anyway. For now anyway, we'll just call them valves for now. Okay? So that's messy. Yours probably looks a little neater. So that's just labeling the heart. So not too bad. So like Savannah mentioned, the heart will have its own circulation too. So when you hear like coronary arteries, so coronary means heart, so those are the blood vessels that are going to your heart. Okay, so we'll talk about that more because we're going to do disorders, so that's where heart attacks happen, so we'll talk more about that after, but we won't label that here for now. Okay, so let's add to this aorta and ventricles, okay? Wait, how many did I have there? Or sorry, our atrium, sorry. And in your slides, how did I see blood? Okay. I before E, except after C. atrium receive blood, and let's just say ventricles. Ventricles. So they, let me see, how do I make it simple? Pumps blood out. What's out of the heart? Receives blood in the heart. Okay, so the right side and the left side do slightly different things. So your right atrium and your right ventricle, both of them are receiving blood in the heart. But your right atrium, and we'll go through this step by step, so don't panic. Okay. Receives blood from the body. And your left atrium receives blood from your lungs. So both are receiving blood into the heart. I know, right? It's all one giant loop. It's all one, the heart, the whole cardiovascular system is, well, it's really two loops, but it's all just one big closed system.
So the right back.
Yes. So, right ventricle. No, right ventricle pumps to lungs, and left ventricle
It's backwards to the
pumps. So, and that's because the atrium, it's not pumping out to things, it's receiving it in, kind of, but we'll talk about that just wait. Left ventricle pumps to body.
We're all gonna walk out of here.
Yes, you can be heart surgeons. Oh, just one second, guys. I'll be right back. Hello. What's going on? Oh, exciting. Oh, that's fast. You're gonna get your blood work done while you're there too? Cool. I'm pretty much in here all day.
No lunch?
Yeah, but I have to prep for my class after lunch.
What time's the lunch though?
12:30.
If I'm done by then, I can pop down and
Sure. My office is in this room right here, like where that big photocopier is in there. My office is in there. Very cool.
Like I said, I'm heading up there now.
Cool. Does Mom have the baby?
No, she's...
There's a bathroom out that way. Or you know this room.
No, man.
Oh, right. Yeah, go. Oh, right. So you're going back today, too?
Yeah.
Yeah.
But I didn't know if...
Cool.
head along.
No, I wish. That would have been nice. What time's your appointment?
I'll be there at 10:45.
No.
But not for work.
Bummer.
But they'll give me pictures, right?
Most of them will, I think. Yeah. All right, I'll see you later. Well, because it will be less messy for when I'm coloring and showing you the blood flow. Continue with your hearts. It will be less messy if I just do it this way. Okay. Sorry, guys. That was my sister. She lives in PEI, and she came over. She can't get a doctor over there, so she's getting an ultrasound. So she's like, was hoping I wasn't teaching and I could go to her ultrasound, but but that's okay. What's that? Yeah. It's kind of exciting. She is like 20 weeks, but she doesn't have a doctor. So I got to be the first to hear hear the baby's heartbeat like last week. Yeah, it was kind of nice. No, she's already gone now. Yeah. Okay. I know, it's true. It's her second. Yeah. Yeah, she has a little girl who's almost 3. She lives in PEI. No, she's been on a wait list for a doctor for like 3 years. Yeah. Oh, and you guys will hear my conversation with my sister if you're interested on YouTube later. I just remembered that. I have to remember to pause before I'm doing that. So if you're really nosy, then I'm like, I know. These jerks are in here and they won't come out. No, I promise I didn't say that. Okay, so let's go through the blood flow of the heart. So if your body, oh Jesus, here we go. Okay. Yeah, exactly. Lungs are next, Brian. We'll do lungs next. Oh, break. No, give me 10 minutes. That's because he's a smoker. Yeah. He's craving. It hasn't been 2 hours because you went after your test. I saw you. Oh, well, maybe you went to the bathroom, but just give me a few more minutes. Okay? Okay, so our body is using up oxygen, using up nutrients, so then our blood, after it's done there, we'll talk about that more later. After it's done there, it's coming back to our heart. Okay? So when it's coming back to our heart from our body, would it have lots of oxygen or low oxygen? Low, because our body's used it all. So low oxygen, I'll make blue, okay? So if it's coming from our body's up here, say, more body down here, because we have a top half and a bottom half. Okay, so our blood's going to come down into our superior vena cava and our inferior vena cava. So from our body into these vena cava. So this is blood we're talking about. We're doing what? So this is deoxygenated. Low oxygen blood, I'll make blue. Yeah, so you can color it blue or you can make blue arrows, whatever works for you. But this is the part that will have, here, we're going to start right here, body. Superior, inferior vena cava. So blue, I'll make deoxygenated, so that's low oxygen levels, okay? Does it what, sorry?
See how this part is? See this thing? Yeah, look.
So that side of the heart is all deoxygenated. So if you want to color, so we'll get to the right atrium and right ventricle, and that does carry deoxygenated blood. So you're good if you want to do that. Yeah, don't get ahead of yourself. Because you asked. But I'm getting there.
Okay.
Yeah, we're good. We're good. Okay, so from our body, so we have our blood in our head and our arms, our blood in our legs. It's deoxygenated now because our body cells have used up the oxygen, so it has to come back to our heart. So it's come from our body into the superior and inferior vena cava. So let's think of that as it's kind of its first stop, really, in the heart. Okay? So once it's going in there, so you can color this all blue if you like. So these two things lead into the atrium, the right atrium. So all of this you can color blue if you like. Because all of this will contain deoxygenated blood. I'm going step by step, so this is kind of just showing you the steps of the blood. So we started in the body, and then the first place we're coming into the heart is the superior and inferior vena cava. So the next stop is here, which is the right atrium. So once it comes from our body, so that atrium is receiving it from our body on the right side, and it's deoxygenated blood. So the atrium, so when you're listening to your heart, what does it sound like? Yeah, or bub bub, bub bub. It has kind of like two sounds, right? Yes, and they sound a little bit different. So the first sound has to do with after these top atria contract. So this will contract and push blood down into this ventricle. So this squeezes and squeezes blood down into the right ventricle. So we still have deoxygenated blood, so it's still blue, okay? So that's into the right ventricle. Yes, sorry, number 4, yep. So that could be your 4th step. Technically, you could start anywhere here because it's all just one big loop. It all is going to come back to the beginning again. Sometimes it's just easier to pick a starting place, so we'll start with the body. Okay, so this ventricle's a bit bigger. So it's a bit bigger because ventricles usually have to pump blood further than an atrium. The atrium only has to go from here to here. This ventricle is going to go out to the lungs. So this will pump, this will squeeze and squeeze blood up here. Does anyone remember what this structure is called? Pulmonary arteries, yep. Yep, and it goes. So, because the blood is squeezing up here and out there. So we have a lung over here, and we have a lung over here, because we have 2 lungs, right side and the left side. Well, most of us have 2 lungs. If you're a smoker, you have 0.5 on each side.
You're getting your day wrong, Philip. It's your day, buddy.
Oh, he knows. Oh, no, he knows. He knows. That's right. He's already in trouble. Yep, because both. And so here, this is something that will trip you up. So generally in the body, arteries always have highly oxygenated blood, except for right here. This is the only place where you're going to find an artery that has low oxygenated blood. So we'll talk more about blood vessels. So low oxygenated blood in these pulmonary arteries to the lungs. So what happens while it's in the lung? Picks up oxygen. So now we can change to red because we have oxygenated blood. So let's make our lungs step 6. If you're lost, make me back up. What? Go ahead. What, Lindsay?
So it goes from the arteries into the veins?
So from these, right, so these arteries are going to the lungs, and while it's in the lungs, so we'll talk more about blood vessels, but while it's in the lungs, it will change into veins. So it's leaving the heart via arteries to the lungs, and then it's coming back to the heart via veins. So in the lungs, it changes over. Did I answer?
So lung goes back in.
So step 7, we're coming back into these pulmonary veins.
Both of them on the side?
Yep, because we have 2 lungs, so we need 2 sets, right?
There's 2 pulmonary veins on each
Oh, both on each.
Yeah, there's this one up here too.
Oh, okay.
Yeah.
But it's all 4, right?
Yeah, so you're labeled right.
Okay, cool.
The way you labeled it's fine. So that's step 7. coming into those pulmonary veins. And this will feel overwhelming, but it's the very first time you've learned it. It's supposed to feel new and stressful. But the more we work with it, the better it'll get.
So we're getting red now.
Because it's oxygenated now. Because in the lungs, you're picking up oxygen. So now you have nice, highly oxygenated blood.
Number
7
7?
is right here, coming into the pulmonary veins here, okay?
And on the other side too?
Yep, so those are pulmonary veins too. So we have 2 sets of those because we have 2 lungs, so it has to go to both lungs, right and left sides. Okay, so once it comes into that pulmonary vein, the veins, it's coming into the left atrium. So now we have nice oxygenated blood hanging out here in the left atrium. Sorry, tell me to move.
So that 8?
So atrium, squeeze blood into where? Into the ventricle. So next stop is the ventricle down here. So it kind of looks like it because this aorta goes behind the pulmonary artery in the diagram. So number 9 is that ventricle. So that ventricle is kind of our strongest piece in our heart because that ventricle is responsible for pumping blood into the rest of your body. Okay, so this guy pumps and it comes up, so it's kind of underneath here, so you have to envision that it's moving underneath that into the aorta.
I was like, how does it get, oh, I see, because it's behind.
Yeah, it's just kind of, picture it being a tunnel underneath the pulmonary artery up into the aorta, okay?
Where am I? What? 5.
And so your aorta up here is all nicely oxygenated blood. And that's going to the rest of your body. And there we go, we've made the circuit. And then once our body uses up all of that oxygen, it comes back over here to the superior and inferior vena cava. They're your doctors.
Why is there 3 nipples on there?
It branches out. So we're going to talk more about blood vessels and how they branch out as you go through the body. But the aorta doesn't just stay like that, because that's a huge blood vessel. It has all kinds of branches that will come off of it to give blood to your whole body.
What's that?
That's the bottom part of your aorta. So it's just showing it's looping around here. Yeah, so that would be to your body too, down your lower.
Yeah, it's about size.
Yeah, it's just still part of your aorta there. This is it too there. So just as a very quick review, our body's using up oxygen, and then the blood is coming back into our heart through the superior and inferior vena cava. So its first stop is the right side of the heart. So when our heart's taking in blood, it's coming to the right side. So it's the atrium, which contracts and pushes it into the ventricle. The ventricle, so that's your lub. Then your ventricle contracts, and then you hear your dub, lub dub. So we'll go down and listen to that. And then when that ventricle contracts, it's pushing it into the lungs, through the pulmonary artery. In our lungs, we're picking up all the oxygen, and then it's coming back into your heart, into the left side now. So your oxygenated blood's on the left side into your atrium. Your atrium pumps into your ventricle. This left-sided ventricle pumps into your aorta, which goes to your whole body. So that's delivering that oxygen from the lungs to the rest of your body. Okay, so we'll go over that some more. We'll do some more stuff with it. But for now, you can have a break.
This outer lining,
Yes.
all just go.
No. You can just leave that. But this side of the heart is deoxygenated and this side is oxygenated. So if you wanted to do all of this red and all this blue, you could. Yeah. Yes. These are pulmonary arteries. So after here, it branches off to the lungs. Is this what you mean right here?
Yeah, the one in the center. See the little piece in the center? Over to your right, the bottom. Right there.
Yeah, so that's showing the branching off of this. You could make it blue if you want. This could be blue, and this tiny piece here could be blue if you wanted.